Every 5 years, everyone in Australia participates in the nation's largest statistical collection, the Census. Data collected helps inform important decisions that benefit individuals, families and communities, helping build a better future for all of us. More than just data, every stat in the census tells a story. The Royal Flying Doctor Service covers our vast, expansive land to deliver timely healthcare to the people of rural and remote Australia, a vital service which is of huge importance to small communities across this country.
Fundamentally, the Royal Flying Doctor Services provide care to people who are outside the reach of normal hospital and treatment systems. So across every state and territory in Australia, there are people who struggle to get access to healthcare services. The Royal Flying Doctor Service has 23 aerobases spread across the country. We fly 79 aircraft from those bases, operate 150 road transport vehicles, 1,900 staff. So obviously that's a huge effort of coordination to make sure that we're able to deliver the right care to the right people at the right time.
The Royal Flying Doctor Service is essential for rural and remote Australia. Without our service provision, many of these communities would have no access to any healthcare.
Census information is critical to planning the sorts of services that the Royal Flying Doctor Service deliver. We're delivering services to 7 million people across 7.7 million square kilometres of Australia. So we really need to understand where people are, the size of the communities that they're living in, the sort of breakdown of those communities in terms of age and demographics, understanding which communities are Indigenous, where there are pre-existing conditions and so forth, all helps us to plan the most effective services that we can possibly plan across that very vast country.
One day you might be responding to a stroke or a motor vehicle injury. The next day you might be doing a primary healthcare clinic in a remote location. They often meet us on the tarmac and many shake our hands and thank us for coming, and it's an absolute honour working for the Royal Flying Doctor Service, and it's all about the community. It's the community engagement and experience, and that's why many of us do the work we do. It's about the community response and their true love and passion for us.
In the face of serious accidents and serious illness, it's often the Royal Flying Doctor Service that people rely on to provide emergency medical care and to get them to hospital.
I mean, some of my most recent memories is providing COVID services to rural and remote Australia. A gentleman by the name of Tyrone really stands out to me. He was the first Indigenous man in the Kimberley to receive his Pfizer dose. During the COVID response, I'm using our census data every day. Before we send out a COVID clinic, we need to know how many people are in each location, which in turn helps us determine how many doses to take to those locations.
We can only provide that care if those very same people are providing the sort of information that's required of them in the census to just make sure that we're delivering the most effective care that we possibly can provide.
The Royal Flying Doctor Service is one of those services that makes a real difference to all of Australia, because each day you're achieving something new. You're achieving something for rural and remote people, patients and community.
Look, the Royal Flying Doctor Service means to me what it means to most Australians. It's this idea that every Australian matters and every Australian deserves the sort of healthcare that we all enjoy, and that your health outcomes shouldn't be dependent on the postcode where you live. It's a really exciting opportunity to make a contribution to people who are really appreciative of the services that they get.
Every stat tells a story. Visit census.abs.gov.au.